Hi, Dr. Martin Rutherford. This is the next in a series of our functional medicine back to basics. I've had many people clamoring to me, when are you going to start doing the treatment part? So I'm doing the treatment part. And so we've talked about basics, we've talked about exams, we've talked about histories, we've talked about priorities, we've talked about really the foundational stuff that needs to be set up for your treatments even to really be effective in the functional medicine world. And a lot of times we've talked about how when you do those back to basics, then, or when you do those basics, that a lot of times a lot of the problems will clear up doing blood sugar, doing stress hormones, doing low blood pressure and getting those things under control. You can look back at the segment on priorities to see what I'm talking about if that's something that sounded like that was interesting to you. So once you start getting the physiology under control, I think the important thing in functional medicine is there's a hierarchy of care. And in fact, I was just at a seminar this past weekend with my mentor, Dr. Krasian, and he was talking about gut function. And he was talking about a north to south approach, meaning you should look at the gut from north, meaning your mouth, to south, meaning the other end of your the other end. And you should look at it in a specific order. Well, that expands across the board to every case that comes in here. If you have a person, we have people come here with neurological cases, dizziness, vertigo, balanced migraines. People come here with gut cases. People come here with fibromyalgia, chronic fatigue, Hashimoto's, autoimmune, those types of things. That expands it. Gut is part of that. But you have to evaluate that case, and then you have to figure out for that particular case, what should a specific hierarchy be for that case. Now, that doctor I just mentioned, Dr. Krasian, actually developed something called a metabolic assessment form. I live and die by this form. You can't get it unless you go to his classes, okay? And he's got it copyrighted, and so I can't send it to you because I'm talking about it on here and he would sue me. So he probably wouldn't. He's a really nice guy, but I can't send it to you. So anyway, so it's kind of in an order. It's kind of in an order of the way that you would treat. So the first part's like what's called dysbiosis, which largely happens in your large intestines. And then the next part is leaky gut, and the next part is chemical sensitivities. Now, technically, this is an order in which, in theory, the physiology breaks down. But everybody doesn't break down the same way. So this gives you the opportunity to gather an awful lot of data from the patient and then be able to, having studied functional medicine, know the hierarchy in which you should proceed. But I'm going to spend the next several weeks, probably more than several weeks, going over the specifics of this metabolic assessment form, because this metabolic assessment form directs you to treatment, and if we go back to diagnosis, it also directs us to what tests we should be doing. And within the framework of each of these categories, category 1 in general is large intestines and dysbiosis. But within each of these categories, there are also specific questions that lead you to start to understand what's going on with the patient. So the first category is a category relative to the gut bacteria. So you've heard about the microbiome, the infamous microbiome. Sometimes we start out with the gut, sometimes we start out with the liver, sometimes we start out, so okay, let's just use fibromyalgia, okay, because we've seen a zillion fibromyalgia cases, and for some reason, I mean, that seems to be a big interest in my audience. Fibromyalgia and chronic fatigues and thyroid seem to be very popular, very popular among my patient population. And so let's just say you have Hashimoto's. Let's just say you have fibromyalgia. So we would gather all of the data relative to what we've said, and then we would look and see what you have here on your metabolic assessment form. If you are in chronic stress response, that is a hierarchy for us, and we will talk about the brain after we talk about the rest of the system. But we will usually find out what we think is wrong in the general immune, digestive, endocrine system, okay, and treat that at the same time we would treat the chronic stress responses, which are all over our website. So if you want to know about that, you can go to powerhealthtalk.com and look about stress and chronic disease and fight-flight syndrome and those types of things. So the gut. So the gut frequently is the first place we start. Not always, but the gut is frequently the first place we start. I went to that seminar last weekend. Dr. Crosby made two statements that I thought were very, very prescient. He said, you can't supplement your way out of most of these cases. They're a part of it, but that's not how you do it. That's what people are trying to do online. And he said, and he's getting really upset because functional medicine is becoming all about the gut and the diet. He says, functional medicine now, you go to the doctor, you got a functional medicine doctor, they put you on like the 4-hour program to get your gut under control, and they put you on the autoimmune paleo diet, and then that's functional medicine. It's not. But it can be a big part of it. We start out with the large intestine. A lot of people don't realize that the dysbiosis, all these things that they're hearing about, a lot of them are in the, and I made a mistake when I said microbiome. That's more the small intestines, but your large intestines. So large intestines. So here's the symptoms. Okay, let's say you have fibromyalgia. Let's say we've already discovered that with you have fibromyalgia, you have an autoimmune problem, because you usually do. And so we're going to be looking to dampen your autoimmune your autoimmune responses. And one of the first places we're going to look is to your large and small intestines. Large intestines, the symptoms would be feeling that bowels do not empty completely. So, and within the framework of this entire category, there are specifics. So lower abdominal pain relieved by passing stool or gas. Passing stool or gas means we have a bacterial problem. Gas is a bacterial problem, okay? It's the breakdown of bad bacteria. You can get a couple of different types of gases, but if you get a methane gas, that's SIBO. That's in small intestinal bacterial overgrowth. That can be gas, that can be bloating, that can be passing large amounts of foul-smelling gas. You're passing large amounts of foul-smelling gas, and you get distension after you eat, there's a good chance that you might have something called small intestinal bacterial overgrowth. That alternating constipation, diarrhea. Now understand, we're treating a case, we're looking at the gut, and we're like, okay, 75% of the immune system is in the gut. This person has Hashimoto's, whatever it is. If you have an autoimmune problem, which most of my patients do, 75% of the immune system is in the gut. Most of you have mystery diseases. You're struggling. You can't figure out what's going on. And everything's normal, and your doctor's telling you to head. Most of you do have an autoimmune component to your condition. Okay, so another symptom, alternating constipation and diarrhea. This is called irritable bowel syndrome. Okay, irritable bowel syndrome alerts us to the fact that the person's probably in a chronic stress response. They're now calling irritable bowel syndrome irritable brain syndrome. Again, you can look at our irritable bowel syndrome presentations on powerhealthtalk.com. But this area directs us to a number of things, because irritable bowel syndrome is going to tell us you have to work with the brain. However that particular practitioner works with the brain. They may actually, I practice functional neurology also, okay? So we do brain rehab exercises. We have a lot of tools here that we use to calm down the stress responses in the brain and give that person the tools. We have herbs, we have botanicals, we have brain rehab exercises, we have different types of techniques here that we can help have the patient take home, and so from looking at we're looking at the bowel aspect of this metabolic assessment form, and it's telling us it's brain, okay? And other symptoms of your large bowels, diarrhea alone. If you just have diarrhea alone, I hate diarrhea because it can be so many different things. It can be segmented filamentous bacteria. That's some of the other bacteria that can break down. The number one cause of diarrhea here is usually people aren't drinking enough water, or they have a bacterial infection in their gut. But there, if you've been up in the mountains, of course it's like, do you have a parasite? But constipation is a little bit easier. Constipation, number one cause is usually stress. Number two cause is usually thyroid problems. Constipation can be, again, it can be your person's not drinking enough water. Hard, dry, small stools, same thing as constipation, a little bit different. That also will indicate to us that the person's either got thyroid or stress response. Coated tongue or fuzzy debris. Most of you out there probably know. We would use the term dysbiosis. A lot of you would say that's probably candida, and it can certainly be candida. We see more broader bacterial infections, passing large amounts of gas. That smell, we talked about how that might be small intestinal bacterial overgrowth. So this is like the category of bowel symptoms. Now, why would you go to the bowel first? Why would you not go to the small intestines first? You kind of do. I'm going over the bowels right now. The bowels and the small intestines certainly work together, but they are very differentiated in the way they are treated. So if you're having like a chronic problem, the first place you're going to go to people who come in here, this may not be you, but the people who come in here all are in some sort of a chronic fight-flight response. So you'll notice that a couple of times I said that's what's causing the bowel problem. So if the person has that problem, they can take all they want to do. They can take Metamucil, they can take magnesium, they can do all the things that they want to do, and their constipation is not going away unless you fix that stress response. What I'm going over here is everybody wants the magic bullet. Okay, everybody wants the magic bullet of what do I do for this? But as you can see, these bowel symptoms have different causes. Some of them have bacterial causes. Some of them have different types of bacterial causes. Some of them have a brain cause. Okay, some of them have a specific, like maybe candida type of thing. Some of them are small intestinal bacterial overgrowth. So those are all different things. Now, as I talk, and I'm talking a little fast here today, but like as I talk, if you have the passing large amounts of foul-smelling gas, you're going to want to look up SIBO. You're going to want to look up small intestinal bacterial overgrowth, and you're going to want to look up treatments for that. And we're going to talk about that. Okay, but basically, SIBO, you're going to have to kill the bacteria. You're going to have to starve the bacteria. So that's a special diet. If you're looking at the fuzzy tongue there, that's a special diet, okay? And that may be different than, or it may be the same as the SIBO diet. But most of the time, that's a different diet. And then you can use herbs and botanicals and things of that nature. And most of you in the alternative field know to starve the candida bacteria by not giving it sugar. You know you may not know that you should kill it. But you may also not know that later on we're going to talk about hydrochloric acid. And if you do all of this stuff, and you don't take your Bragg's apple cider vinegar or hydrochloric acid tabs, that once you've taken the things that you should take to get this under control, it's going to come back, because the hydrochloric acid that's not there in your stomach should be there to kill these bacteria when they try to come back. So constipation is a huge one. It's one of the biggest reasons we start with this aspect of the physiology. The two reasons that we start with the gut is autoimmunity, and the other reason the three reasons is autoimmunity, leaky gut and food sensitivities, and constipation. Constipation is because why? If you're constipated and you're not pooping, you're not detoxing. All that heavy load that is being done in your liver and your gallbladder, your intestines to detox you, if it's not getting into the toilet, it's getting into you. Now you're itchy. Now you may be getting different types of skin things. So constipation is very important, and so that's something that if you do have constipation, if you can take magnesium, if you do have a number of these alternative medicines that can get you unconstipated, that's a good thing to do. Most of the time, if you have to get the stress response under control, you have to get the physiology under control, then you have to get the thyroid under control, and then your constipation will go away. Sometimes it can be sluggish gallbladder, sometimes it can be a sluggish liver, gallbladder, maybe even pancreas, and you're not getting the enzymes there. So sometimes enzymes will do it. But the trick is get the liver, gallbladder, pancreas under control. And so so I mean, there are lots of different things that you can use, but you have to figure out which it is. So I'm kind of going through this to show you that, like, why a lot of things you've done has failed, and why sometimes you need to figure out, like, find something or somebody who can put all this thing together for you and say, which one of these things should you do? You might go on a baseline diet where you get on the autoimmune paleo diet and you take out all of the allergens and all of the antigens, all the foods that will flare up autoimmunity, and this all might go away. It might all go away, because it may be that those things were the things that were flaring everything up, okay? If they don't go away, then you should stay on that diet, because that sets a baseline. It takes all this inflammation away, and then you look at it and you go, wow, you know, I have this coated fuzzy tongue, and it's still there, and I'm on the diet, so that didn't go away. So now what you would do is you would actually do a test. We would do something called a GI stool test. We would look to see what's in your stool. We would look to see, do you have other bacteria? There's a lot of things. Are you making pancreatic enzymes? Are you making gallbladder enzyme? Or is the gallbladder making, ejecting its bile and creating anti-inflammatory enzymes and breaking down your fats and so on and so forth? So again, just the internet thing is like okay for some things, but really the internet thing is like selling supplements, it's selling herbs, it's selling botanicals, and it's really not for the chronic condition patient. It's something that you need to get involved in a little bit, understand a little bit more what's going on, so you can attack, and then understand you can take you can take herbs and botanicals for the fuzzy tongue, but you have to understand if those herbs and botanicals are killing the bacteria, and if the diet's killing the bacteria and you're feeling better, but it comes back later, you have to look at the rest of the hierarchy of what's going on and find out, did it come back because I don't have enough hydrochloric acid in my stomach? And this is like, there's not a lot of other things than what I'm talking about. So let me just be clear when I say I am giving you some clinical pearls here. So in other words, is it that there's a lack of hydrochloric? You've done your Candida cleanse. Is it that there's a lack of hydrochloric acid? Do you need to start taking Bragg's apple cider vinegar or hydrochloric acid enzymes or something like that, and enzymes? Or is it that there's a stress response that's causing the hydrochloric acid problem? And that's the main flow for the gut. No matter what you have in the gut, if you've done it, if you've gone through a small intestinal bacterial overgrowth protocol and it worked, if you've gone through a cleanse and it worked, you've gone through a fast and it worked, and it always comes back. The three things to look through is your thyroid working? Because your thyroid slows your gut down. So if that slows your gut down, you're not making enough hydrochloric acid. Are you stressed? If you're stressed, that's going to cause you to not make enough hydrochloric acid in your stomach. Hydrochloric acid decrease is what happens long before you get ulcers. Or do you just not make enough hydrochloric acid? There's something called parietal cell antibodies in your intestines, parietal cells, and the parietal cells make hydrochloric acid. Sometimes people can't, those cells don't work. Sometimes there's an immune attack against those cells. So do you even make hydrochloric acid? People who have Hashimoto's have this parietal cell antibody thing a lot, maybe 40, 50, 60% of the time. So that person's going to have to take hydrochloric acid for the rest of their life. The other two people, maybe they get their thyroid better and they get their brain better, and all of a sudden they start making hydrochloric acid. Now they do their Candida thing. Now they do their SIBO thing, and they're better. And if you do that, as we'll talk about in the future, maybe a lot of these other things get better. Maybe the leaky gut gets better. Maybe the hydrochloric acid is now good, as we'll talk about later. Maybe that'll help your gallbladder and your pancreas to start working. That's functional medicine, okay? This is functional medicine. It's not throwing something, throwing darts or throwing spitballs at different things and just hoping that one of them takes. There's a hierarchy to care, and we're going to go through that hierarchy. So the starting hierarchy is usually look to the brain. Okay, so it's going to be look to the brain. Maybe you meditate, maybe you exercise, maybe you do tapping exercises, maybe you do self-guided meditations, maybe you take herbs or botanicals, whatever it is. If you treat this gut without treating the brain, there's a good chance you're going to fail. And so the hierarchy is first look at brain, and in general, the intestines is a pretty good place to start for people who have chronic conditions that won't get better. It's not the mother lode for most people, but it is a good place to start because then it can clean up a lot of other things.